Good afternoon, everyone. I thought it would be useful this week if I talked to you before we welcomed everyone back to school next week on Monday. Firstly, I want to start by thanking you all for supporting us and working with us over the last few weeks, months, and for some of you, year since the pandemic started. It's been really challenging for everyone, and I appreciate your willingness to work with us, be flexible, and work in the kind of situation that we found ourselves in together. We do appreciate how tricky it's been for you all and how challenging it can be to balance the needs of your children with the loss of the usual routines, the loss of the usual schooling, and keep going with the usual demands of your house and your job. So thank you so much for doing that. As a community, I think we have done a terrific job, and we've pulled together, and I think we've really had a good time for those children who've been in school, and I think those of you who've been at home learning with your children have also done a great job of supporting them and supporting schooling as well. What we have done by working together is enabled school to remain open throughout, and with very little disruption in comparison to perhaps what we could have had. We've also had very few cases of COVID altogether, and they have not spread widely around the school. And this, I think, has been because of your willingness to follow the rules and because of the protocols we have in place in school. So I've got two purposes really today, just to talk through some of the systems we do have in school so that everyone's familiar with them, and to ask for your continued cooperation and support over the next few months. So we're following all of the government guidance as we have been throughout, and some of the specific things we have in school are that we're going to continue with our staggered arrival and departure times to reduce the amount of people in any one place at any one time. Hand sanitizer will be used as children and adults arrive and depart from school. We're going to continue with our staggered breaks and lunch times to reduce the numbers of children in the dining hall and the numbers on the playground together at any one time. Some children will be eating in class, again to reduce the numbers in the hall. We are going to keep the windows open in class. There are extra hand washing facilities in class, and the numbers of children using each individual toilet area in school has been reduced. Likewise with the school resources, not every child is accessing all resources at the moment, so that again we are keeping some reduction in the sharing of resources, and all shared resources and all resources in class are being cleaned more frequently. We have a cleaner in school as well who cleans all of the toilets and all of the handles and all of the areas that we all use all day, twice a day, every day, to again support additional cleaning. We're continuing to have no trips going out into the community currently, and no big size kind of groups within school, with no visitors who are not absolutely essential to school, and no big kind of community gatherings or assemblies within school. We have lidded bins for the collection of tissues, which are double bags, and lots of messaging and signage across school to try and support children walking around in one way, and to support us in understanding how to wash our hands and how to blow our noses and dispose of tissues in a safe way. Staff still have the option of wearing face masks when they feel that reduces their anxiety or health concerns, and in communal areas staff will be wearing their face masks as per the guidance. Staff are also completing asymptomatic testing at home twice a week as per the government guidance as well. We've been doing that for about 4 weeks now. Staff will be covering as much as possible within their bubbles to try and reduce the numbers of staff moving across the school. So we hope that with all of those measures continuing to be in place in school, that will help to keep everyone as safe as we can, help to keep school and classes open and functioning well for the next few weeks and months. And we hope perhaps after Easter to be able to perhaps enable more access to more of the facilities again for a greater range of children, if everything is going in the right direction and we're remaining well with a low number of cases. To help us with that, I ask that you do keep your children at home if they are poorly. Now with children it can be very difficult, I know, to know how poorly they are. They don't always show that to everyone at the same time, do that. They can go up and down within a day. But the children must stay at home if they have a temperature, a loss of taste or sense of smell, if they have a new and persistent cough. The government has also commented on other symptoms that may be prevalent with COVID, such as sore throats, fatigue, diarrhea, headaches, usual coughs and colds, and winter symptoms. Now, it is really essential that we do keep everyone at home who has those symptoms to prevent the spread of COVID, and also to prevent the spread of other infections around the school, because in a busy special school, infections can spread very easily from the children to the adults as well. When the adults are then off, that then creates trouble in covering classes and keeping the classes safe, which could lead to staff class closures, and we don't want to do that. So I ask that you keep being extra vigilant with your children's health to help us to keep school open and functioning well. Once again, I'd like to say a huge thank you to you all for working with us as you have done throughout the whole of this time. It has been terrific, the community spirit, and I've really appreciated everything that you've done to help us over the last weeks, months, and as I've said, year. It really has been a community effort. Thank you so much. If you've got any questions for us, if there's anything that you're worried about, please speak to your class teacher or Karina, our family liaison officer, or myself if you see me at the end of the day. We're quite happy to answer any questions that you have. Thank you very much then. See you soon.